Hi, I am Dr. M.R. Pujari. I am dental surgeon as well as implant specialist at iSmile group of dental clinics, Bengaluru, Karnataka. Teeth whitening, many patients always they want white teeth, and the teeth shade differs from patient to patient. It is actually genetic, but a habit related teeth, yellow teeth, or you can say brown teeth due to excessive smoking, the paan masala chors and dark coffee, wine, who frequently take, they often get discolored teeth, and in that case normally dentist will recommend you teeth cleaning followed by whitening, which can make your teeth look better. But we should also understand that the teeth whitening, we use a chemical base. Basically these chemicals can harm your enamel to a certain extent. If you are quitting the habit and you want your teeth to be white, and then definitely teeth whitening is recommended, and after the teeth whitening your teeth will become much better. Like earlier, whatever teeth shade you had, you can get back to this thing. And since you are doing a chemical based teeth whitening or a laser teeth whitening, patients often encounter teeth sensitivity for 1 to 2 weeks, that we can manage with the teeth desensitizing paste to bring down the sensitivity. But if the patient has inherent stains, like we call as a fluorosis stains, from his childhood, due to more fluoride in the water, the teeth will be pretty brown. That cannot be solved with the teeth whitening procedures. We call teeth hypoplasia there. It can actually damage your enamel. Now, as we know, enamel is an irreversible tissue. If you keep on doing these teeth whitening procedures frequently, they can damage your enamel, and enamel is often irreversible, and it results in more porosity. Patients often encounter more sensitivity of the teeth. Over a period of time, it can even result in more teeth cavity problem. So teeth whitening is recommended either once or twice maximum at different shades, to get different shades, recommended by the dentist under the supervision of the dentist. And teeth sensitivity is a common complaint after the teeth whitening procedure, can be managed with the desensitizing paste. Many patients ask, doctor, any home remedies available for teeth whitening? Teeth whitening, you have home remedies, but whenever you use any chemical based, like patients, you get many of the videos saying baking soda, charcoal, these basically harm your enamel. And if you don't know the correct way of using them, it can always damage your enamel. It is always better to take your dentist opinion before directly jumping into home remedies. You have commercially available silica-based toothpaste that can also, when you use it for a longer period of time, it can damage. Ideally, you can even, when you clean your teeth or rub your teeth using toothbrush, and little pinch of salt can also bring your teeth little shade whiter. But when you start doing it frequently, then definitely it can damage your enamel. So if you are asking for a home remedy, a pinch of salt with few lemon drops you can use with the toothbrush just to get one shade better. But if you start doing it every day basis, that can damage your enamel. So all these abrasive agents, basically they can damage your enamel. Always do these whitening things home remedy or at the dentist only after taking a dental opinion and dental supervision.